Hey folks, Blair Shackleton on behalf of Nose Creek Sport Physiotherapy, where we get you moving faster and feeling better. Today we're going to talk about my two favorite hip stretches. As hips stiffen up and get less flexible and weaker as we age, man, they put a lot of load through your back. So the first modifiable risk factor for back pain is just getting our hips moving. And if you stretch on a regular basis, within 2 to 3 weeks, you'll probably get a lot of your flexibility back and you'll be able to move more through your hips, which takes the pressure off your back. So here we go, let's just get into these right away. The first one I'm actually going to lay down here. I'm going to go right on my back. I'm going to pull my left knee towards my opposite right shoulder as far as it'll go. As soon as you feel like the hip is stopped, stop there. Then grab just above the sock line and I want you to pull that leg up. And you can drop your head back and really pull on it so you get a strong stretch in the back of the hip. So we're going to feel that is right through here, kind of the back of the hip. So it's almost like your kind of modified piriformis stretch, but you're getting more than just your piriformis. You're getting a lot of that tissue in the back of the hip that tends to get really tight, because as we sit, our knees tend to sort of fall apart to the side. Not fall apart, but relax to the side. Okay, so that's for the posterior part of the hip. Okay, for the front of the hip, what we're going to do is we're going to come up here, and then I'm going to come up onto one knee. Okay, and then basically what I'm going to do is I'm going to do a little bit of a pelvic tilt. So if your pelvis is a bowl, we're going to like dump the bowl backwards. So imagine that being a bowl and you're just tilting backwards. So as you tilt backwards, you should appreciate a stretch here. And then what you're going to do is you're going to lean into that stretch a couple inches. That'll create more stretch. And then squeeze the cheek in the back. And by squeezing the cheek in the back, you're going to feel a real strong stretch in the front of the hip. You want to hold that, if you can, for a good 20 to 30 seconds. And then obviously repeat on both sides. And again, really hold these stretches for 20 to 30 seconds. My theory and my sort of approach is that if it's tight, do it twice. So again, if in a couple weeks you're like, wow, these aren't as tight, I don't feel as much stretch, well, congratulations. At that point, what you want to do is just do each one once after an activity. And obviously when you're stretching, you have to be sweating. So you want to do this sort of after you've gone for a walk, jog, hike, cycle, swim, whatever your activity is, and just re-lengthen those muscles out, because as we exercise, muscles tend to tighten, so we want to re-lengthen them back to their normal resting sort of position so that they recover and they don't feel as sore the next day. Alright, so that's our stretching, our hip stretching video blog for lower back pain, for reducing lower back pain for today. So on behalf of Nose Creek Sport Physiotherapy, I'm Blair Shackleton, where we get you moving faster and feeling better. So try those two hip stretches, let me know how those go, and hopefully you'll start to have more mobility in the hips and a lot less back pain. Alright, so take care, talk to you soon, bye-bye.